Thank you. I'd like to invite our three speakers back, and then we'll have a quick panel discussion. If you guys have any questions, feel free to, we want to keep it interactive. Yeah. Oh yeah, cool. Perfect. So I would love to, let's see, are we all sitting in our right spaces? Oh, it doesn't really matter. We know who we are, right? So I'd like to first kind of dive into, into our theme right now of kind of like the DAOs, right? So you guys have worked with a lot of traditional companies, traditional institutions. What makes the DAO structure work for research and for your teams?
Yeah, it's been interesting because I'm kind of running a company and a DAO at the same time, and comparing and contrasting the two. What's really interesting on the DAO structure, it's just more natural that people come there motivated by the mission, because it is decentralized and you have this variable participation rate. So you can participate as little or as much as you want to, and the people that step up their participation levels get into more of the governance and leadership positions. So it's been really powerful because our organization, I feel like I've got a bunch of entrepreneurs. So it's very dynamic and it's very global. And the cost structure is a lot lower than my software company for more people doing things better and faster in many cases. And then because of that, as a open network, I found we've become a magnet that has really blown me away anyway in terms of the quality of researchers and drug developers that we've attracted. And I'll give you a couple of vignettes on that. Like the drug developers in particular, we've attracted some super experienced people from industry, from places like Novartis and Pfizer and Merck. And they're semi-retired, or they're certainly out of the big pharma, but they're doing independent work, and they're just fascinated because there is something that was bothering them when they were in industry, that they couldn't do these things, and they feel empowered. Like we are thinking of how to do things differently, and I've been wanting to do this my entire career, and here is where I get to kind of scratch that itch. So it's really been cool. Yeah.
And I will echo that. He had like a level of flexibility that you usually don't have, like in a classic structure. De facto, you're meeting like people from a totally different horizon, totally different skill, at least like skill that I didn't know even exist. Maybe at the beginning you're pushing away people from your own domain. Like at least like the clinician, it was really like trying to convince them that it was okay. Like it's not going to be like something like that will get them in trouble. So that's the fine balance in terms of like your community, like attracting like new talent. That's great, but also having like your historical community looking at you like you become like totally crazy.
Well, I agree with all my colleagues said. I just want to complement, because DAO gives you the option to also work outside your field. So you can also collaborate with other DAOs and other fields that in the science you would not be able to do in such a straightforward way. And also, I think DAOs is making the transparency in science more visible. It's putting more science out for the big population that usually don't read scientific papers at home. So if we speak up with our work as a DAO, I think for the big population it's easy to understand than just a scientific paper per se.
Cool. So in that case, like for the researchers themselves, right, the folks who receive funding from your DAOs, how is it different from receiving funding from, let's say, a institutional source?
Well, Yeah, I moved my arm too fast. Well, it's totally different to receive funding from DAO in comparison with NIH or big agencies. Usually DAOs pay you in tokens, so the university needs to be willing to manage those tokens as well. So there is what comes the governance and all the guidelines that we need to build for DAO, because it's not that easy for MIT, Harvard, or any other big institutions receive tokens and buy reagents using tokens, or just or even to publish, because to publish your data you need to pay per reviews that usually are really expensive. And NIH allocate, if you send a grant to them and this grant gets approved, you already have allocated for buying reagents, paying personnel, taking care of HR, for example, managing your money. In our case, for the 2 IPs that we have funded so far, one it has been being managed by the university. So the University of Wisconsin, they are learning how to work with tokens, how to work in Web 2 and Web 3 wallets. And the other one, the university didn't want the research to get acquired the funding, but we are trying to find other ways to make his research progress faster. So I think those are the differences that I can see for funding.
Yeah, for us, I'll be brief on it. We're faster, we're faster than most other sources of money in terms of making decisions. And then we end up filtering, we end up putting a lens on translatability and commercial viability on research that many researchers hadn't thought about. And so it ends up being this filter for the ones that are more either adept to that or are inclined to be open to that. And so we're about to fund a 5th one now. So out of those 5, 2 of those were with universities where we have a tech transfer office involved. And 3 are literally independent researchers. One is at a university but it's a European one that doesn't require a formal arrangement between the university. It's between us and the researcher. And so we tend to attract more entrepreneurial-minded researchers, I think, at this stage.
I'll let you know once we start funding external project next year.
I'm looking forward to your progress for sure. So I guess like a lot of these institutions, science has a pretty centralized kind of governance structure, right? Whether it's the NIH you receive funding from or the review boards at your universities or et cetera. How does the DAO change that? How is it different in that sense, in terms of governance?
I mean, I would say first, you choose people you start the DAO with, which I think is pretty different from being in a position in an academic institution. So at the beginning, because all of us, I'm assuming, we starting the DAO was optional. Nobody forced us to do it. So the environment of the core team and your key partner, in our case, was a bioprotocol, incubated us. You choose this environment, which basically by itself is a big difference that versus being in an institution where you have 5 boss above you and a lot of sensibility to manage, and therefore this has a huge impact on the governance because you're part of a common objective, common project.
Yeah, and then there's probably a diversity across DAOs because everybody's got their own. If the question's how's DAO governance different from governance of a funding organization like a foundation or an NIH? Yeah, it's more grassroots oriented. You get to define it yourself. The community's involved in defining it for the outcomes. And with us, we started with the mission in mind and what we thought the solution would be, which was instead of looking at diseases, treat brain disease as a function of aging, increase the number of shots on goal we have, and increase the diversity of hypotheses so we can move things along faster. And so then we formed our governance around that, like how do we get to the outcome of a lot of ideas that we can fund many and fail fast at, and how do we have a commercial mindset of we want, when we fund things, we don't want to just learn, we want to be funding things that we feel we can get into humans and have results. So we form governance around that, and then that's how we function as a funding organization.
I guess some folks might think that, yeah. Actually, yeah.
Can DAOs become a way of actually incubating potential companies down the line, right? So we have been discussing a lot of like how DAOs can actually increase research. Majority of the research being research still in academia, right? But I think with the decentralization that AI is pushing, it's gonna push basically the scientist citizen, right? And I guess my question is, in that ideas, is like how DAOs can actually promote creation of companies as well.
Yeah, so Sam, like this is up to each DAO. Like so, with Spine DAO, we're in the process of creating like a for-profit branch, because the DAO is a foundation. So as the foundation is not allowed to accrue wealth, I believe. So we're creating a for-profit, which would have like 100% owned by the DAO. And that will be part of like the circular economy. So basically like the for-profit, and I'm only talking about the model that we have in mind, will be the one selling the product on the market, covering for some development expense, and then the money goes back to the Spine DAO that can do like some buyback like the token and burn, and the value of the token increase. So the DAO by itself is not, has nothing to do with DeSci. The DAO is a framework. Like in this room, we apply it to DeSci, but you can do a DAO for anything. That's true.
Yeah, so the answer is yes to that, and I think there are a couple different ways to look at it, but some of these models exist in life sciences already, like Flagship Pioneering and a few others. Yeah, they're VC companies, and I think if you want to really harness the power of a global collective and a community, what we're trying to do is create, and it's like I saw with Spine DAO too, and Athena, you create these tools that are powered by the data and the community, and so what you're doing is almost creating the infrastructure by which citizen scientists can then come and be much more highly likely to succeed if they're funding and developing with us. And so right now it's a lot of manual stuff where we have translational drug developers actively involved in managing projects with researchers and guiding them through, but it's all toward building more and more tools that then, in addition to the funding, a person with a great idea or a person can even discover a great idea or a great target and then naturally just drive it through Cerebrum on our platform, right? And so that to me is the more interesting way, because it's the more empowering way to attract researchers from anywhere on the planet who might have the skill sets and abilities to do it, and just enable them with the tools and the funding, and I think that will evolve over time, but I think that's the potential where DAOs can go, which would be truly disruptive, because now you truly are grabbing the best of the best from anywhere in the world, as opposed to you can think I can put 10 or 50 or 100 people together and we're going to come up with the best ideas because we're really smart and we have a lot of money. And so I think it is a disruptive model that way, and I think that's where these do end up.
That was an interesting question actually brought up by our audience member here. I mean, I guess there's some concern from folks where the DAO could potentially just become a company itself, right? And whales become, let's say, a director of a company essentially, or they play a similar role. And how do you guys see that progressing in your DAOs, or how do you kind of prevent that from happening?
What would you like to prevent that? You know, I mean, it's not necessarily, not everything is always like a black or white. You know, that if that's one way, like to bring solution to the market and to the end user, we can think about this as just as a vehicle, as long as you stay true to your mission. So that's why, like, I don't know, like how. Maybe I didn't fully understand.
Collaborations are always important. So if you can collaborate with big pharmas, DAO, that is really helpful. But if you can collaborate with people that are globally all over the place, that usually is going to give you results faster. And I think DAO is built for that, to be more globally. If you have a company, we're going to have a company in certain area that is going to sell the product for that country, and DAO, you can do that all over the place. So I think these are the biggest difference.
I look at it as progressive decentralization, and the proof is in the pudding, right? Look at the tokenomics and look at the governance. And, you know, we can talk about DAO and decentralization, but the fact of the matter is, if you started out purely fully decentralized, nothing would get done. So, like, you need a concentrated core, you need concentrated, motivated people who are motivated by large token positions to start, but you're looking in the governance to say, do they have a plan for progressively decentralizing this and allowing people that are contributing, are building, and are creating in the ecosystem to earn more and more tokens over time? And as the processes get in place, you know, are you seeing a more broader distribution of the tokens? And so our approach is we are progressively decentralizing, where you should be able to see that in the Neuron tokenomics and how we operate.
In terms of like the proof being in the pudding here, what do you think are some of the key successes that, like maybe like the one biggest success you've seen out of your team that could potentially maybe convince a skeptic out there?
Well, our first IP NFT that are in the market not that long, it's like 4 or 5 months. It was a drug that is going to the market very soon for treatment of a specific case of endometriosis. And it's a type of pharmaco that everybody have access, but nobody use for that regard to treat that kind of disease. And we have data now that push forward showing that medication is also good for the prevention of endometriosis and ovarian aging. So this is a spin out that Athena DAO is doing, and I think that is something that also will increase the name of DAO as well, because DAO is not really it's not visible as a company. It's like a foundation, but we are trying to build a company, a globally company per se. So, yeah, I think those are the things.
Yeah, for us, it's the first human clinical trial. So we're taking a natural product into a human clinical trial. It's going to be 154 participants, double-blinded, placebo-controlled, and we've developed it as a decentralized study. So it's being done for less than, like, roughly $500,000. So this would normally be like a $2-3 million trial, and nobody would fund it. And, you know, what we know is, you know, this, I mentioned it on my talk, pathology is developing for Alzheimer's and other neurodegeneration for decades. This product's been on the market. It's incredibly safe. It's been used by hundreds of thousands of people. And we've got strong mouse model evidence and human cell data evidence in vitro that it works. And nobody's tested in humans, and nobody would have funded it. The DAO comes along, we raise and crowdfund. We've got hundreds of token holders of this token. We raised $500,000, and the thing's going into a clinical trial in a couple weeks, and we're going to know whether it works or doesn't work. If it works, guess what? you now have something that costs you $70 a month that's neuroprotective and can really help prevent a lot of these negative outcomes that's incredibly safe. So like this is the whole thing about delaying these diseases, and DAOs are more inclined to do that because the people that are funding it are saying, I want a solution and it's not happening. Give me something I can do now and buy me more time while you go hunt the therapeutic that I'll need 20 years from now or 30 years from now.
Yeah, and I think what surprised me the most is how fast does it go? Like, and that's, I think, was clearly illustrated by your answer. Like in a classic environment, you will still like be looking for funding. And at the beginning, I was like, I'm going to do this DAO in parallel to my job. It's going to be a few hours a week, and now I'm like, oh shit, I need to leave my job, because it goes fast, because like the community and people, and you're meeting new people and you're making new contact, and you have like this enthusiasm, sometimes a little bit some pressure. So you deliver and you work and you wake up at 4 in the morning to do a conference call with somebody that is in the other part of the world, but it goes fast, and that's exciting. That's refreshing. Like maybe sometimes we make some mistake, but that's okay. Like we're also like flexible. Like make a mistake, you learn and you start again. So there's no sense of punishment, because that's part of going fast and being surrounded by so many diverse people and skill. Like it's actually a lot of fun.
Yeah, it sounds like fast feedback loops and everything. Yeah, I would love to take a question from the audience here.
My question is for Brian. Out of your presentation, I think they were all great. Thank you so much. I think this is why we're here, right? To advance these solutions and curate disease faster through blockchain and AI and all these things. So Brian, I wanted to tap and double click about the digital addiction aspect that you had on there. I'm certainly 39, and I kind of like have this awareness that we've been using these devices, computers, for the last 30, 40 years. And I feel like, I don't know, our hands, my fingers, you know, our posture, right, spine, all these things. What do you think on that digital addiction? Like, I can really feel it. Like, I'm going to be 40 next year, but I can feel, you know, like I was born with computers since I was a baby, right? Like, so I was wondering if you can guide us what you guys are doing on that, what you think about that.
Is the question like what do you do about the fact that we're all
what are you doing
digitally addicted, or?
I have no idea on the topic. I just had it. So I'm aware of that, and I don't know. I just saw, this is the first time I saw something scientifically in terms of digital addiction, right? For the brain, I know you focus on the brain, but in general, like between our bodies and our brains, I'd love to hear your perspective on that.
Yeah, so I'd say two things on that. One, so the Exponetics solution that we're working with, because we've licensed the metric for measuring your brain health, and then it turns out there are all these brain healthy habits that you can practice. And so the whole idea is, like, we're not going to get rid of our phones, we're not going to get rid of our computer devices, and we're certainly not going to stop using AI. Like, I don't want to go back to that world. Like, I like the world where I can, you know, go on my phone and I can have a sandwich in my hand in 15 minutes. So the issue is, okay, what do you do about that? How do you adapt your lifestyle, and how do you have these reminders that you should still go outside, look at the sky, and, you know, reset your brain, take breaks, go for walks, interact with other people, not through glass, but in person. And so there are a whole bunch of things that we teach about brain health and that we can actually measure in a digital index on that. And so that's one of the ways we're trying to combat the digital lifestyle that we've created for ourselves and we know is going to continue into the future, that can help, you know, even increase the power of this, you know, supercomputer on your shoulders. So that's one thing. And then how do we get better at that? We are looking at taking that metric, which is more of an assessment-based compilation of metrics, and starting to capture digital data through wearables and other things and correlate that to see if we can have a more dynamic index that just goes off of your stress levels and your body signals, so we can tell you how your brain health is throughout the day and throughout the week, and recommend interventions for you. And then, obviously when it comes down to, supplements and therapeutics and other things, we can track what those interventions are doing against that score as well. But it's kind of twofold. We're using the, digital stuff to get more data to learn more about what we should recommend to you. But also we're measuring and making recommendations to deal with the fact that, yeah, our lifestyle today is degrading our brain health. Financial Times actually had a study on this, and in addition to cognition dropping after you're 45 if you do nothing about it, if you do something about it, it actually bends. But they also noticed a precipitous decline in cognitive performance even as young as people in their 20s. That started in, wait for it, year 2010, which, oh, by the way, was the year the iPhone came out. So, yeah, we need this.
Thank you. Looks like your recommendation is to touch grass. Yes. I know that we're running a bit low on time. I would like to first off make a request, which is that everybody take some photos for us and then post us to social so that our moms and dads can see it, and we can also, get some boost on our socials here, please. I'll take one more audience question and then close it out.
Cool, right here. Oh, my phone just shut off. Okay, so real quick, for US-based DAOs, do you guys choose like Wyoming and or New Hampshire? And then second, are you guys offering token holders governance voting rights in the DAO, and how has those voting decision outcomes shaped the direction of your protocols?
So yes, in our case, we are offering tokens as reward for contribution. Each level of contribution have a very range of tokens that you can receive. And the other question was about New Hampshire, if it's allocated in New Hampshire.
Where your DAOs are, and more so the voting governance token.
So it's a community driving vote. So everybody that is part of the Athena DAO vote in that proposal or in that guideline that we want to change. It's always about vote. Everybody needs to vote and is connected with Web3 wallet. So everybody knows who is voting and who is not voting in the community. So allocation, I'm not sure if DAO needs to have an allocation. In our case, we are globally, but it started on Canada, so it was not in the US. So I'm not sure about DAOs that are based here.
Ours is a Swiss association, so we're a Switzerland-based legal entity. So we didn't mess with U.S. jurisdiction at the time. This was several years ago, and it just was not a friendly place to go think about issuing a token from. The token holders, so the Neuron holders, get votes in all governance that goes through. So there's a governance plan that's put out and talks about what thresholds are required for token votes versus we also have a soft governance process to help us move faster. So some lower threshold stuff, you vote on Discord in a token gated channel. So all we know is that you own tokens, but we don't know how many. But the big stuff, it gets on-chain token voting. And then we're starting to think about some more utility for the token with an app that's coming out. And you'll be able to do things like stake your tokens to priority areas, right? So do we want to focus on, Down syndrome, Alzheimer's disease, or do we want to focus on frontal temporal dementia or, schizophrenia or something like that? So, and there'll be some subcategories, so that'll help people kind of give us indications of where we should be trying to source deals from based on the community's priority.
And nothing really to add. We are also like a Swiss foundation association. Yeah, a Swiss association. Like I think you were incubated by BioProtocol also, and that's apparently that's very classic for the DAO.
Sounds like so European focus for a lot of the bio DAOs and a lot of kind of direct democracy among the token holders, right? Cool. I guess to wrap it up, what is the one thing that we can all do to get involved with your projects and your DAO, and what kind of help? How can we help?
Making access to Web3 easier. and less scary. Just a small task.
Yeah, we are creating a community app. That's really the primary objective of it, is that a normie, like a non-Web3 native, can come in, connect the bank account, buy our token, and participate. So this is, the reality is we're not going to go anywhere if we're not reaching the patient communities. The end users of this are the people that are affected by these diseases and conditions. And we shouldn't have a requirement that they're Web3 experts or even Web3 native at this point in time. We need them. That's how we go from like a niche following like this to hundreds of millions of people engaged. And that's how we're disruptive and make a difference. So.
Well, I do believe that now what we mostly need help is increase the community. So call more person in. And now we need a lot of help to acquire also different fields for women's health, that we can be training our agent that is going to be good for the big population. So if someone has suggestions on women's disease that we should be focused on, we are always open to suggestions or collaborations, or even people that want to use Zoe and train Zoe for before the release is also pretty much welcome.
Thank you, everybody. And thank you to our panelists here. Please take some pictures and post it to our socials. Thank you.